Hi everyone, welcome back to the Self-Confidence Chronicles, and if you're new here, welcome. I'm Dr. Christy, and I make videos about body positivity, living your best life, and with the occasional fun, vlog thrown in there, and just all about lifestyle and balance. And today I'm actually going to be starting a mental health series on my channel. For those of you who don't know, I have a doctorate in clinical psychology, and I've been a therapist for about 10 years now. And one of my my specialty is working with eating disorders. And I have a lot of experience working with binge eating disorder specifically. So I thought I would start there, and hopefully over time do more and more videos talking about just different issues having to do with mental health, and talking about what are some of the criteria in mental health disorders, and as a way to work towards removing some of that mental health stigma that, I guess prevents people from seeking treatment, but also normalizing it a little bit more, because there is no shame and embarrassment from seeking treatment or needing mental health treatment. But because eating disorders is my area of expertise, I thought it would be great that I would start with that first. So, but if anybody does have any specific requests that you would like me to cover in future videos, please let me know in the comments below, because I would love to do that. Okay, so let's get started. What is binge eating disorder? And I think over the last few years, we've been hearing more and more about this diagnosis, and mainly because it's a newer diagnosis, and it only went into the DSM-5 in 2013. So prior to that, it was not recognized as a formal diagnosis in itself until 2013. I wanted to start specifically with binge eating disorder because the prevalence of binge eating disorder is significantly higher compared to anorexia and bulimia. And believe it or not, binge eating disorder is 2 to 3 times more prevalent than bulimia and anorexia combined. So it's at least double or triple the number of the individuals who struggle with it compared to anorexia and bulimia combined. What's also important to note about eating disorders is that they really are not a choice, and eating disorders are not as simple as someone just eating food or not eating food. It's a lot more complex than that. Also with eating disorders can be very scary because they actually have the highest rate of mortality of all of the mental health issues. So they have the highest death rate compared to any other mental health disorder. So they are very serious, and they can be very scary because they're so life-threatening. The prevalence of binge eating disorder is about 3.5% for women, 2% for men, and that might possibly be a little bit higher because men typically tend to seek treatment less often than women. However, that is starting to change a little bit more, but it's possible that that number might be a little bit higher, and about 1.5% for adolescents. Binge eating disorder, it doesn't discriminate. It is found in all age groups, all races, all income levels, so it doesn't discriminate. So what are some of the risk factors that are associated with binge eating disorder? Family history can be a big risk factor for a number of things. So is there a family history of weight issues on either side? Trouble gaining weight, trouble losing weight? Are there any medical issues? Is there a family history of eating disorders? A number of things can increase the risk of binge eating disorder. Are there any psychological issues? Anxiety and depression are very common for someone who struggles with binge eating disorder. And a lot of times, most people will experience that prior to their diagnosis. It's also not unusual to have a past history of trauma as well. That's very common for individuals who struggle with binge issues. Past history of dieting is also a risk factor for binge eating disorder. So it's not unusual for someone who struggles with these issues to report that they have spent years and years yo-yo dieting, that they've tried every diet in the book and failed, and there's lots of going back and going forth. Definitely an increase in risk factor for binge eating disorder. A couple important things to note is binge eating disorder is not about weight. So there is not a stereotype of this is what somebody looks like with an eating disorder. With binge eating disorder, you don't have to be overweight to have this diagnosis. And in my work with individuals, I have worked with people who've struggled with binge eating on all ends of the weight spectrum, being underweight, overweight, average weight. It affects everybody. However, approximately 2 out of 3 people who do have binge eating disorder are overweight. So the prevalence is slightly higher for those who are overweight versus of average size. An important thing I also wanted to note is that 30% of those seeking weight loss surgery will meet criteria for binge eating disorder. And that number is just staggering to me. It's partly why some people might not be as successful in weight loss surgery. And I'm not suggesting that someone not have weight loss surgery if they need it. However, if they are struggling with the symptoms of binge eating, it's really important to get that treatment there as well so that they can be more successful in the long run. So what are some of the characteristics that are associated with a diagnosis of binge eating disorder? Recurrent episodes of binge eating that occur at least once a week for a period of 3 months. Reports of eating a larger amount of food in a very short amount of time, and it's usually within 2 hours or so. So a binge is eating a very large amount of food within usually about a 2-hour time frame. It's not unusual too for individuals to say they'll start with something sweet and then they shift to something salty and then they shift back and forth. Sometimes there's patterns and rituals that are associated with it, but it generally is eating a very large amount of food. However, I do want to differentiate that binging here, I'm talking specifically about very large amounts of food, not just a couple of cookies over 2 hours, but excessive amounts of food. Whole bags of chips or bags of an entire cake, things such as that. That's what I'm referring to here within that time frame. In addition to these symptoms, there's a lack of control during this time frame. So someone will say, I felt like I was out of control, and once I started, I couldn't stop. So feeling like you can't stop eating and that you're out of control during this time. Sometimes people will also say that they feel like they're on autopilot. Unfortunately, a lot of individuals who struggle with these symptoms often get overlooked, misdiagnosed, or underdiagnosed for a number of reasons. And one of them is the shame and guilt that's associated with binging. It is very difficult. There's a lot of shame sometimes associated with these binge episodes because it is excessive amounts of food. A lot of people struggle with the shame and guilt associated with these binges and really aren't, open to wanting to share their binges with a treatment provider. And they don't want to share because, there's a lot of fear about being judged by them and shamed. Sometimes there's a lot of negative attitude and weight biases if someone does struggle with weight issues, and I mean externally and internally. So that individual may have their own internal struggle and shame about maybe their behavior and their appearance, but also then there's this fear of judgment by their provider too, that they are also going to shame them. Sometimes binge eating gets overlooked because of the presence of other medical issues or even psychological issues. So if somebody is struggling with anxiety or depression, sometimes the symptoms of the binging get overlooked because the depression takes precedence, and we start to treat the depression but then kind of ignore those symptoms that the binging is going on. Another thing is the presence of medical issues. So if someone's struggling with maybe high blood pressure or their blood sugar levels are really high, naturally their primary doctor is going to want to get those symptoms under control. And again, the binging kind of gets overlooked because these other symptoms take precedence over it, and in the end it kind of only perpetuates it. So what can you do if you are someone that's struggling with some of these symptoms? I would highly encourage you to reach out to a therapist to get some support there, specifically someone who works with treating eating disorders. I think would be most helpful. And what they'll do is help you to work on identifying what some of the underlying triggers are that might contribute to some of this binge eating. In addition, they might help you work on strategies and interventions to help you and to help you work through some of these urges, and also to implement new coping skills and understand maybe what are some of the contributing factors and why you're resorting to binging to cope with your emotions. Another resource that I would highly encourage you to seek out is your primary care doctor. Medical doctor can perform a physical and do some blood work. With binge eating disorder, there are a lot of medical comorbidities that are associated with it. And like I said at the start of this video, eating disorders have a very high mortality rate. And some of it is for medical reasons. So I always recommend getting that blood work done, getting a physical, just to make sure that you're in the best of health. A registered dietitian is another person that I would highly encourage you to reach out to. Specifically, a registered dietitian who's trained to work with eating disorders. And a registered dietitian is someone who generally has a master's degree in dietetics, and usually they'll have like an RD at the end of their name, the initials. But what they will do is help you to get on a regular eating schedule to normalize your hunger cues, and also help you meal plan, help you kind of just gain those hunger cues back, and just overall start to work towards improving your relationship with food. Because in the end, eating disorders really are not about the food. The food is a symptom of a bigger problem. Another resource I would highly encourage you to look into is possibly seeking out a psychiatrist. And a psychiatrist would be helpful. They would do an assessment and determine if they think that any medication might be helpful for you. And again, not everybody needs medication. A psychiatrist might be helpful in determining any medication recommendations, and if that might be helpful in just kind of alleviating some of those symptoms as you're working with your therapist to gain a better understanding of what's really going on with this eating disorder. So what can you do if you're a friend or a family member or know somebody who is struggling with these issues? Being very mindful of your words is so important, and what we say really does matter. Things such as you just have to really want it, or you just have to have the willpower. What are some other ones? If you're binging on grains, stop eating grains. These are all things that only drive someone with an eating disorder further into that cycle of eating disorder. So just being very mindful of our words and remembering what we say matters. if you are someone who's struggling with these symptoms, I want you to know that recovery is possible and help is out there for you, and you're worth it. So I hope you liked today's video and learned a lot about binge eating disorder. I hope you like the start of this mental health series, and like I said at the start of this video, if there are any specific topics in mental health that you would like me to cover, I would love to hear from you, and please write them in the comments below. So thanks for sticking around. Don't forget to like and subscribe below and check out my other videos. And if you'd like to see other content from me, you can also check out my blog at the selfconfidencechronicles.com. And I'm Dr. Christy, and I will catch you next time. Bye.